If you have started losing hairs in your crown and you took some medicines for it for some time and it didn't work out for you, or the effects of the medical treatment was just very minimal for you, and if you are now planning to get a hair transplant for your crown specially, maybe you have visited a clinic or few, sent your pictures to a few clinic, but some of the doctors are giving you 100% guaranteed results, and some, when you search on the net, find out that the results are not so good in the crown. So what is the mystery of the crown? How do a cosmetic surgeon or a hair transplant surgeon plan a crown hair transplant? What are the nuances, small points of which he takes care? What are the difficulties in a crown hair transplant? This is a very, very important topic. What are the challenges here? How do we ensure that the direction of the hairs in the crown is same as the normal direction? So in this video, we are going to discuss these extremely useful points for you. So what are the challenges in the crown? First challenge is that the donor side of any person is limited. The number of grafts which you can extract from the back side or the donor side, safe donor area, is limited. You cannot take out indefinite number of grafts. And the priority is always given to the front because a person is recognized as being bald, especially if they are bald in the front and not so much in the crown. But what if crown is also balding along with this? Then we have to plan in such a way in which there is a differential gradient of the density in the way in which we plan out a hair transplant. Other thing is that the crown can expand. Whatever stage of hair loss you are, it can further expand in crown unless it has become stable, which generally happens after 40 years of age. Other thing is that the hairs are directed in a different way than in the front. In the front, they are just parallel to each other, whereas in the crown, they are coming out like a wall. So these are the very important challenges or the points which are to be taken care during a crown hair transplant. I am Dr. Satya Saraswat, a gold medalist, plastic and cosmetic surgeon, a diplomat of American Board of Hair Restoration Surgery, and I am serving patients of hair loss and hair transplant since 2006. If you are planning a hair transplant for your crown area, please mention in the comment section below and also subscribe to our channel to watch such useful videos. Before we move on further, I would like to tell you that in this video, we are going to discuss a technique which can improve the results of even poor hair transplants in crown. So please keep on watching this video till the end and do give a thumbs up if you are liking the content till now. So when we say that we have to follow the normal angle and direction of the hairs, similarly you can see on the screen that this patient has a wall which is in the lower quadrant and the hairs are coming out like this, which I am drawing right now just for the demonstration purposes. That how do we recreate the wall here? The wall here is in this center. This can be in the right lower, left lower, right upper and left upper quadrant, and there is a special classification for this. Now in the crown up to the transition point there is a wall, and this is the area which is adjacent to the transition zone, and here you can see that the hairs are going straight ahead and merging with the remaining hairs in the mid scalp. So we have to be very careful that we have to recreate this wall like this. Here the angle is very, very important, and after the hair transplant is done, making the slits in the direction which we have shown you and inserting the grafts in the same slits, we have to be very careful while sleeping also. We cannot sleep straight, otherwise there will be a pressure on the transplanted area. So you have to sleep either on the sides or in the face down position. Also very, very important point for you to note is that if you are not taking finasteride and minoxidil or are not keen to do so, then you should not go for a crown hair transplant, because if it expands, then only a small island of transplanted areas will remain and these hairs may thin down over a period of time. Full growth of crown hair transplant happens in around 18 months as compared to the front, where the hairs will fully grow out within 12 to 15 months. If you want to know more about it, if you want to plan your hair transplant with us, please call at the number given here. Now on the screen you can see some of our crown hair transplant patients. You can see how they look before and how they look after. All these patients are very regular with the medical treatment which we have prescribed to them, and do not miss out on them. That actually improves or adds to the longevity or the type of growth you have after your crown hair transplant. Also, we have an app known as Saraswat Hospital App on which you can see the kind of results you will get after your hair transplant, and this is totally free and available on both the app stores. Now, the technique which can increase or improve the results of crown hair transplant is scalp micropigmentation, and you can see on the screen here there are multiple patients in whom they have undergone a crown hair transplant, but because of limitation of the angle and limitation of the number of grafts and due to the angle between the two hairs, there is an increased scalp show which decreases even by a single sitting of scalp micropigmentation, as you can see. If you find this video useful, we request you to share this video with your friends or colleagues or family members who are planning for a hair transplant. To see a testimonial of one of our crown hair transplant patient, please watch the video on the left, and if you want to know more about medical treatment for your ongoing hair loss, please watch the video on the right. Thank you.